Now to some COVID concerns ahead of the holiday weekend. This as the CDC extends the mask mandate on public transportation, including airplanes. Transportation correspondent Jill Benitez has the latest.
This morning, spring travel soaring. An average of more than 2 million people screened at U.S. airports every day. Now the TSA is extending that mask requirement on travel for another 2 weeks until May 3rd.
We've had our time with it, had enough of it.
I feel like it's a good idea to have it still, implement it.
The mandate was set to expire next Monday, but officials are pointing to the rapid spread of Omicron subvariant BA.2. COVID cases are now climbing in 30 states. That new subvariant estimated to make up more than 85% of new cases in the U.S. And for the first time since January, COVID-19 related hospital admissions and ER visits have ticked up. But industry executives want the mandate gone. Delta's CEO saying he feels strongly about lifting the requirement.
And that individuals, including our own employees, make their own decisions and take personal accountability for their health.
Airline officials argue it also puts an unfair burden on their employees who have to enforce that mask mandate on planes. Meanwhile, this morning, Boston health officials are reporting that the community positivity rate has now crossed that 5% threshold of concern. It's at 6.2%, and George, just last month, that number was 2.2%.
Okay, Gio, thanks very much. Let's bring in the White House COVID coordinator, Dr. Ashish Jha. Dr. Jha, thanks for joining us this morning. What do you make about this BA.1 uptick?
Yeah, good morning, George. Thanks for having me back. So we know from data from UK and Israel that BA.2 is much more contagious than BA.1, the original Omicron variant. Our vaccines still work, not any more severe, but it is spreading across our country. And so we want to watch it carefully and monitor where it goes. I'm hoping it does not lead to a major surge in infections, but we've got to really watch that very, very carefully.
You've always said the key metric is hospitalization. Stable or dropping across the country, but some uptick in some areas. How concerning is that?
Yeah, so first of all, right, as you said, hospitalization levels right now are at the lowest level of the pandemic. That's the good news. But they are starting to tick up in places with a lot of BA.2. So we've got to watch that. Again, if that becomes a bigger problem, then we're obviously going to want to do something more to curtail that. But right now, my expectation is that is not going to become a major problem across the country. Let's see where the data goes.
What was the thinking behind extending the mask mandate on public transportation for another 2 weeks?
Yeah, CDC scientists basically felt that because the BA.2 variant has just become dominant in America over the last week or 10 days, 2 more weeks of data will be very helpful in figuring out, is this going to become a major problem, or is this going to be something that we're going to be able to manage pretty effectively? And I think with 15 more days of data, we'll be able to the CDC scientists will be able to make a much more data-driven decision.
Holiday weekend coming up, concerned about spring break?
You know, after every holiday season, we've seen bumps in cases, right? And so obviously always a concern. The good news is, again, infection levels are reasonably low. We know how to gather together safely now. If you're going to see somebody high risk, get a test before you do that. I think if people continue to do those kinds of careful things, we can definitely get together over the holidays.
Dr. Jha, thanks as always for your time and your information.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.